Welcome to Pharmative Live. I'm your host, Dr. James Partyka. I'm a clinical pharmacist, research scientist, and the founder of Pharmative. And today we're going to be talking about what you need to know about COVID-19 testing. And Pharmative Live is our opportunity to have an interactive healthcare forum to educate ourselves, to exchange ideas by connecting patients to healthcare professionals and scientists. So you can send to me your questions via text right now live, or you can forward your questions to me at info@pharmative.com, and certainly provide me any feedback as well as with your questions. So again, Pharmative Live is something we do on a weekly basis every Sunday morning at 10:55 a.m. Pacific Coast Time. And it's brought to you by our PNN Plus Health mobile app, which you can download at no cost to you at your Apple and Android stores. And it's a very easy to use application, which has a great music, great entertainment, but also it has healthcare news and insights and a number of different resource tools, all to improve your healthcare and your family's healthcare. So let's begin by talking again about where we are with the COVID-19 pandemic. It is Sunday, May 17th, 2020, and on this day we have approximately 1.5 million COVID-19 cases, and we're nearing 90,000 deaths, which is a startling statistic. And if you calculate the crude mortality rate, it is 6%. And we know that the virus is highly contagious, and there's a significant amount of morbidity and mortality associated with those who contract the COVID-19 virus. Vulnerable patient populations have an increased risk of morbidity and mortality with the virus. And by vulnerable patient populations, I'm talking about elderly citizens, people with pre-existing conditions such as cardiovascular disease, lung disease, those people out there that are immunocompromised with either an autoimmune disorder or on immunosuppressant drugs. Those patients are also at a higher risk of morbidity and mortality. So the first question I'm going to put out there to all of you today is, why do we test? And we test to identify cases of COVID-19 so that we can isolate, self-quarantine, and trace those people that may have been in contact with the person that's positive with COVID-19. This is the only methodology we have to mitigate or lessen the spread of the disease, to reduce morbidity and mortality. That's why we test. We want to confirm that you have the disease as opposed to having some other type of pulmonary problem. We want to identify cases. We want to isolate those people with positive COVID-19, and we want to trace contact, and that mitigates or flattens the curve to reduce mortality and morbidity. Currently, on this day, we do not have any FDA-approved treatments to fight the virus. Those clinical trials are underway, and we hope that one day we will have antiviral agents that can treat and shorten the length of stay and reduce the mortality rate associated with those people that have the virus. And currently, we have no vaccines available for the virus. Those vaccine candidates are currently undergoing clinical trials. So we have quite a way to go in the drug development, in the vaccine development, as measures for us to be able to fight the virus. But right now, identifying cases, isolation, and tracing is the best way we can to flatten the curve. There are many other viruses and other types of diseases where we have not been able to develop vaccines, such as HIV, dengue. These have affected a large number of people out there. There are no vaccines available, and therefore we rely on treatment. Hopefully, and there are a number of candidates now in clinical development, hopefully we will have very soon effective and safe treatments as well as a vaccine. It seems that a vaccine is likely to perhaps be available sometime next year. Okay, so let's talk about testing. And we talk about a test and ordering a test with our doctors and clinicians out there. We want to first know why we're concerned about getting a test result and what we're going to do with that test result. And that's something that you can have a detailed discussion with your physician or your nurse practitioner, physician extender, or pharmacist about getting a test, and again, why we're getting the test, and what will we do with the test result. Now, there's 3 terms that I'm going to talk to you about now that can be applied to any screening test. And the first is the sensitivity of the test. Okay? By sensitivity, I mean the proportion of people with the disease who will have a positive test. All right? That's an important number to know when a physician or clinician order any test. What is the sensitivity of the test? If you have a poor test with regard to sensitivity, that is going to be associated with an increase in a false negative rate. That's something we don't want. We don't want people who truly have the disease, but the test comes back negative. So we want a test that has high sensitivity. The next parameter of a screening test would be specificity, which is the proportion of people without the disease who have a negative test. And if you have a screening test, hi Antoine out there, hi Jimmy out there, with a poor specificity, that's going to increase your false positive rate. So again, we would not want any test with a high false positive rate because that's going to assume that you have the disease and so forth. It's going to lead to additional testing, or it's going to lead to different methods at which we can manage your false positive. But again, we would desire any screening test to have a good sensitivity rate as well as a good specificity rate. Now, when they conduct these tests, and especially for when we're talking about COVID-19, there are many tests out there. There are many different types of assays out there. The instrumentation is going to determine the quality of the test. The sampling technique and the sample that was collected will determine whether or not the test results are accurate, the operating procedures, all of these things, as well as the timing of taking the test. So if you were exposed to the virus yesterday, you may or may not, because it's too soon after exposure, test positive for the disease. So again, when you took the test is going to influence those test results as well. Now, just in summary, again, a good screening test for COVID-19 is going to have a low false negative rate and a low false positive test. And there has been concern And data has been released publicly as well as published, indicating that some of these tests have too high of a false negative rate. And if you obtained your results through one of these types of tests, you might want to talk to your doctor about following up with a test, a confirmatory test, to see if you truly do not have the disease, or a confirmatory test to make sure you truly do have the disease. And those patients that are at risk to HIV, this is typically done. We use an ELISA test for screening, which has an extremely high sensitivity rate. And if you turn out positive, it's followed up with a second confirmatory test, the Western blot test, which has a high specificity in order to confirm that you truly have the disease. It's important to note that the more you test, the more error you're introducing, as well as more difficult is to interpret what to do with the results of the test. So up front, you want a screening test with a high sensitivity, a high specificity, and I'm going to introduce one other term to you, which is the positive predictive value of the test. The positive predictive value is the probability of patients who have a positive test actually have the disease. And this is calculated by a simple formula, and it uses not only the sensitivity and the specificity in the formula, but also the prevalence of disease. So the higher the prevalence of disease, that is, new and old cases, the higher your positive predictive value. So again, that's something we can ask our doctors when they order the tests. Which test are you ordering? How are we going to collect the sample? The timing of the collection of the sample to the exposure, and then what is the sensitivity, specificity, and the positive predictive value. And again, the higher the prevalence of disease, the more likely that your positive predictive value will be higher. And again, the PPV is the probability of patients who have positive tests actually have the disease. Okay? Following with me. And again, the more testing you do, the more error you're creating in your sample results. Okay. Now let's switch. Okay. Previous to this, I was talking about detecting the virus. Now we're going to be talking about detecting antibodies to the virus. Those are referred to as immunoglobulin M, IgM, and immunoglobulin G, IgG. And they are, when people are exposed to the virus during an active infection phase, they first produce IgM to attack the virus and eradicate the virus from your body. And then during that active infectious phase, IgG antibodies are produced by your own immune system to fight the virus. And those IgG viruses last a long time and eventually provide to you some level of immunity to COVID-19. So you have IgM, which is during the active infectious phase, which go up and then come down during the course of your recovery. And then we have IgG that go up later on in the active infectious state that go up, and then they stay with you for long periods of time. There's a lot of research going on to see if immunity is conveyed by the presence of IgG, and how long does that immunity last. Now, IgM and IgG go up when you're exposed to the virus, but they also will go up when exposed to a vaccine that works. So when we give you a vaccine that works and is determined to be safe, it will convey immunity by your own immune system producing the antibody which fights the virus. So when people talk about tests for IgM and IgG, it's because they want to understand who's been exposed to the virus, who hasn't been exposed to the virus, who may be immune to future exposures of the virus. And recently in New York State, they sampled 60,000 New York residents. We all know that New York is the epicenter in the United States for COVID-19. And they found that approximately 20% of those people sampled had the presence of antibodies. And that's important when we talk to you all about a concept called herd immunity, is when a high percentage of the community is immune to disease by the presence of these immunoglobulins. So if there's a high percentage of people that are immune to the disease in the community, then that prevents the spread of disease in the community as well. So say, for example, you had a room of 10 people and 8 of the 10 people have antibodies and were immune to contracting COVID-19, and you had 2 other people in the room that were COVID-19 negative, but one may have been exposed to a virus from a previous day, but was testing negative. If those 2 people were kind of in the room, those other 8 people would kind of prevent the spread of the disease of one person to another person. That's what is known as herd immunity. So when we vaccinate for a virus like COVID-19, and hopefully a vaccine will be available soon, right? We're trying to improve upon and utilize herd immunity to prevent even the people who don't have the antibody from contracting the disease. That's why it's important that we have a high compliance rate to any vaccination program. The more people that get the flu vaccine every day, the more that protects other people from getting the flu, from other people spreading the flu. So in summary, we test to identify cases, to isolate those cases, to prevent the spread of the disease, and we trace positive cases to identify potential cases, again, to spread disease, which flattens the curve, which is the only methodology we have to decrease mortality and morbidity. We know that this disease is highly contagious. We know that it has a high mortality rate, and in vulnerable patient populations, this mortality rate is even higher. So I'm just going to leave you with one last thought. It's important to listen to your public health officials of what you should do in your community. Listen to your mayors and your governors. If you're asked to stay home, if you're asked to wear a mask, if you're asked to practice social distancing, we do that not only to reduce the risk of your loved ones and yourself from getting the disease, but from other people getting the disease as well, which has a high mortality and morbidity. When we talk about reopening the economy and reopening businesses, it takes healthy people, healthy workers, healthy customers to have a healthy economy. First and foremost, we must think about the health of others, the health of other American citizens in order to have a healthy economy with healthy workers and healthy customers. That's all we have for today. I want to thank you for joining Pharmative Live. I want to acknowledge my partner, Jimmy Mann, for his support in helping put this program together. We'll see you next time. And in the meantime, stay healthy, as it's easier to prevent disease than to treat disease. I'll see you next time. Take care. And again, stay healthy.